This is going to be the patient assessment for the breathing or respiratory issue patient. So you're going to be dispatched to your patient. It's going to be a 15-year-old male. They're conscious breathing. They just said they were having some issues breathing after they were running around on the playground at recess one day. So you're going to get dispatched to the scene. You're going to go up there, make sure the scene is safe, first of all. Make sure everything's okay. No, nothing's going to hurt you. You're going to get your scene safety and BSI. So you got your mask and your gloves. And then you're going to determine the number of patients. In this case, there's one patient, male, trouble breathing, history of asthma. Just going to determine the MOI or NOI. In this case, the nature of injury would be he was running around and it sounds like a exercise-induced asthma. So this time, you're going to make sure he's in a comfortable position. Make sure you keep the C-spine stable, just in case there's any type of injury to that. Consider possibly getting ALS intercept. And with the one patient, you should be good on scene, especially if you have advanced life support on its way. So general impression of the patient when you get there, probably going to be in the tripod position. They're going to have trouble breathing. They might be a little pale. They should be somewhat responsive to at least, especially verbal, when you introduce yourself as the EMT. So in the general assessment, are you going to do the airway, breathing, and circulation? So airway, it's open. This should be pretty decent. The breathing is obviously labored with the asthma issue. So at that time, you're going to take a treatment timeout. You're going to consider giving either albuterol, which would be 2.5 to 5 milligrams with a nebulizer, or possibly Atrovent, which would be a predetermined dosage on a oral inhaler. So you're going to give either the albuterol, Atrovent. That hopefully it'll be a dilator, so it's going to open up the vessels to get the blood flowing, get the airway moving a little bit more, and they're going to hopefully be able to calm down, relax a little bit, help them coaching the breathing, tell them to slow down the breathing a little bit, because usually it's going to be labored, so you just tell them to slow down. So once you get that treatment time out with the breathing, you're going to check the circulation, make sure everything is good to go. Make sure that they have proper circulation, proper blood pressure, everything like that. You're going to check and make sure there's no bleeding that you can see visible. I'm going to say, once you give some type of medication, you're going to make sure it's the right dose, the right patient, make sure the medication isn't expired, make sure if the person has a albuterol inhaler already prescribed to them, that it's going to be the right dosage and prescribed to that person, not that it's some random person that's carrying around an inhaler. So we're going to get to this person to the hospital. We're going to transport, put them on a stretcher, get them to the hospital. At that point, you're also going to go into your OPQRST, ask them, how long was it start, or what caused it. They're going to say, running around the playground at recess and I was having trouble breathing. Does it feel better or worse when you're sitting or laying down on the stretcher? It'll most likely be better just because they're in a more relaxed position. Is it spreading anywhere? Do you feel pain anywhere other than your chest or in the throat, airway being a little bit constricted? How bad of a pain is it, and how long has it been lasting? So once you get that, you're going to get the medical history again, which you may have gotten from dispatch if they say that there was a history of the asthma or any kind of respiratory issues. Figure out if they have any allergies. Figure out what kind of medications they take. If you give them an inhaler, they most likely will have that with them if they know they have the history of the asthma. Last time you ate something, is there any type of history to the asthma or medical history other than the asthma that would cause it to be exaggerated? And events leading, which again you would have already figured out from the kid running around. Then you're going to just do a more focused exam on the way to the hospital and you're transporting. Make sure that you check head to toe. Do the, again, check the airway, breathing, circulation. Check make sure there's no spinal injuries or anything like that. Keep checking the pulse rate. Um, you're going to get the vitals. So you're going to start out with the pulse ox. Go to the pulse ox. You're going to go and check the pulse. Check the skin. Make sure it's, should be hopefully somewhat recovering at this point. Should be returning back to normal temperature and color. Check the blood pressure. Make sure that's still where it needs to be. Get the ETCO2. Check the pupils. Make sure they're equally dilating and that they're reacting to light and everything is still reactive. And then just keep repeating your patient assessment, keep repeating vital signs, check to make sure that the medications you give are working, and just keep transporting. And once you get to the hospital, turn them over to someone with a higher level of care and pass along any pertinent information as far as, things you found at the vital signs, medications you've given, everything like that to hospital personnel.